Let's discuss the 5 transporting points. The Jing-Well points, bladder 67, reaching Yin. Bladder 67, location on the dorsal aspect of the little toe, 0.1 tune from the lateral corner of the nail. How to find this point is located at the junction of 2 tangents that border the nail of the little toe laterally and proximally, approximately 0.1 tune from the actual corner of the nail. Needling vertically 0.1 tune or obliquely 0.2 tune in the direction of the foot. Prick to bleed. Caution, painful joint. For the action indication, bladder 67 is scientifically established the conversion of breech presentation prior to birth. Moxibustion and electroacupuncture at this point seem to be most effective, approximately 70 to 80%. It also facilitates labor. It expels pathogenic factors from the opposite end of the channel and regulates yin and yang of the water element. Special features, bladder 67 is a Jing-Well point, metal point, tonification point, exit point. An isolated case has been reported regarding a pregnant woman who was treated with moxibustion of bladder 67. This resulted in a feto-maternal transfusion of 300 ml of blood, endangering the fetus. For this reason, treatment should be controlled by cardiotopography. As a well point, bladder 67 eliminates wind, both interior and exterior, and is frequently used for the headache from exterior or interior wind. Being the end point of the channel, it can be used to affect the opposite end, and it is therefore used to clear the eyes. For such symptoms as blurred vision or pain in the eye, usually from wind. It is used empirically for malposition of the fetus. This is normally done in the 8th month of pregnancy, burning 5 moxa cones in each side once a day for 10 days. Bladder 67 subdues rebellious chi from the head, those having headache, dizziness, occipital headache, neck ache. It also clears heat, those having red eyes, eye pain. It resolves damp heat, those with difficult urination, painful urination, and also promotes labor. Those having retention of placenta, malposition of fetus, delayed labor, prolonged or difficult labor. Bladder 67 is the Jing-Well and metal point of the bladder channel. Unlike most of the other 11 Jing-Well points, however, it has no apparent classically recorded action of restoring consciousness in case of coma or collapse, and is similarly to the other Jing-Well points is limited to its ability to clear fullness and heat from the opposite end of the channel in the head. The spiritual pivot states the diseases of the head select points from the feet, while Song to Keep Up Your Sleep says that bladder 67 is indicated for disorders of the face and head. Bladder 67 is particularly applicable for vertex and occipital headache, whether due to exterior pathogenic wind or to internal disharmony, as well as for disorders of the neck, eyes, nose, and ears. As the terminal point of the bladder channel, bladder 67 is especially dynamic in its action and in clinical practice would be considered when these disorders are acute rather than chronic in nature. The principal application of bladder 67, however, is the treatment of malposition of the fetus, for which it is renowned. For this purpose, it is treated by stick moxibustion for 15 to 20 minutes bilaterally, or by moxa cones 5 to 10 cones at each point, once or twice a day. The woman should lose her clothes and sit in a comfortable semi-reclining position. It is common practice in China to demonstrate this method to the pregnant woman, who is then supplied with moxa sticks for self-treatment at home. Best results are achieved if this treatment is started in the 34th week. It is important to note that once the fetus has turned, moxibustion should be discontinued. Otherwise, further malposition may be induced. The effect of bladder 67 on the uterus extends further to inducing delayed labor, hastening the delivery once labor has commenced, and promoting the expulsion of the placenta after childbirth. It is interesting to note that despite the intimate relationship between the kidneys and the uterus, it is point of its coupled bladder channel, especially bladder 67 and bladder 60, rather than points of the kidney channel, which have the action of promoting labor. According to Yin-Yang theory, Yang is activity, Yin is quiescence. Yang brings forth and Yin develops. And when Yin reaches its maximum, it will necessarily transform into Yang. The Yin of the kidney nourishes and dominates the development and growth of the fetus through the long months of pregnancy. As the birth date approaches and Yin reaches its zenith, Yang must begin to grow in order to turn the fetus and prepare for the intense activity of birth. If towards the time of delivery, there is insufficient Yang activity of the uterus due either to deficiency or stagnation, then Yang must be stimulated. Bladder 67 is the terminal point of the Yang bladder channel, where the Qi changes polarity and enters its coupled Yin kidney channel, reflected in its name, the Qing-Yin. It is the most dynamic point to achieve the uterus and hence turns the fetus and promote labor, especially when stimulated by the Yang heat of moxibustion. Finally, bladder 67 is one of the few distal points on the bladder channel indicated for disorders of urination. In this case, painful urinary dysfunction and difficult urination. Clinically, however, distal points of the bladder channel are rarely used for this purpose.